Good evening over there in Australia. My name is Dr. Kylee Maclachlan. I'm a haematologist and clinician researcher. I have previously worked at the Memorial-Sloan Kettering Cancer Centre and then now over the last year have been a visiting investigator with the multiple myeloma genomics group at the Memorial-Sloan Kettering Cancer Centre here in New York. I've been working with Professor Ola Langren and Dr. Francesco Mara and collaborating with Professor Gareth Morgan. This is a position which is partially funded by the Snowdon Foundation. As you may know, Sloan Kettering has one of the largest clinical trial centres in the US and has a number of active trials for multiple myeloma. The Snowdon team have asked me to describe a couple of these for you and then also to mention the research that I have been doing. One of the most important trials currently running is for newly diagnosed patients comparing 3 induction regimens, VRD, KRD and DARA-KRD. And critical in the comparison of these regimens is the sensitive assessment of residual disease following treatment, or MRD. Professor Langren is one of the international leaders in myeloma MRD assessment, and we anticipate that the addition of daratumumab will increase the rate of MRD negativity following induction treatment, and this will then translate to prolonged progression-free survival. A second trial that I'm excited about is actually a treatment cessation trial. And this is where patients who have been MRD negative for a period of at least 3 years are randomized to either continue maintenance therapy or to cease. And we anticipate that patients who have achieved this deep level of cancer control for a prolonged period of time may be able to safely cease treatment without increasing their risk of progression. So together these 2 trials may be paradigm shifting in myeloma, demonstrating that intensive, well-tolerated induction without necessarily requiring transplant may provide an increased percentage of patients achieving MRD negativity, and that a proportion of that cohort is then able to safely cease treatment without increasing their risk of progression. Sloan Kettering also has a number of trials running for patients with relapsed myeloma, and the most promising of these are the BCMA-targeted therapies, so both CAR T cells and also bispecific antibodies. So alongside the MRD studies, my research with the multiple myeloma genomics group has been looking at refining risk prediction in myeloma. So we have a number of recent publications looking at the comprehensive signature analysis, where you are able to simultaneously assess multiple biological processes that are leading to the cancer development and to progression. We've also recently published a paper looking at the impact of large structural variation in myeloma. We have a number of papers that will be presented at the upcoming virtual ASH conference. I will present our work on copy number signature analysis in myeloma, demonstrating that it is possible to define complex genomic changes using these signatures and therefore predict survival. A colleague will present work from whole genome sequencing of myeloma precursor disease, demonstrating that it is possible at this early cancer stage to demonstrate that genomic features are different in patients who progress compared with those who remain stable over years. So thank you for this opportunity to present what I have been up to recently. Thank you to the Snowdon Foundation for their support, and I hope that next year I will be able to be there in person for next year's event.